Okay, welcome everyone to ASJ GEMS Global Educational Meetings. I'm Phaedra Kress, your moderator. I'm excited today that we're here with Gemma Sharp, for whom it is 2 a.m. in Australia, and she's gracing us at an ungodly time. And she'll be presenting the psychology of aesthetic genital procedures across the gender spectrum. And just by way of a bio, her title is Associate Professor, and she's a leader in the body image and eating disorder research at Monash University in Melbourne, Australia. She's been working in the field of aesthetic surgery since the start of her PhD 10 years ago, and she's particularly well known for her genital aesthetic surgery research across the gender spectrum, and she was invited to give a TED Talk on this topic in 2017, which is exciting. She's also a senior clinical psychologist at Alfred Health and previously ran her own private psychology practice where she provided psychological assessments to people seeking aesthetic procedures. She served as the lead expert in the Australian Psychological Society's practice guidelines for psychological evaluation of cosmetic surgery patients in 2018 and in 2023. And these guidelines have been adapted internationally. Maybe Gemma, as we're talking, you can pop that link into the chat box if anyone's interested in taking a look.
Absolutely. Thank you so much, Phaedra, for the kind introduction. And thank you everyone who's joining us online right now and people who are joining us for the recording. It's my absolute pleasure to be part of the ASJ GEMS series. And it doesn't matter that it's 2 a.m. here. I'm still very excited to share this research. And I'm more than happy to take questions during the presentation, but also happy to take them at the end. So please feel free to jump in at any time. As Phaedra said, I'm from Monash University in Melbourne. I lead my own research group and I'm a senior clin psych. I have my Twitter handle there on the slide at Gemma Sharp 11, so you're welcome to tweet along if you like. I also have my email address if you'd like to catch up with me later via email. So, oh, hello, yeah, great, the slide changer works. By way of background, as Phaedra said, I started this research 10 years ago. I've been a body image researcher for quite a while, but in terms of genital surgery, it was I suppose my reason for wanting to do this research was that basically we were seeing labiaplasty, particularly labia minora labiaplasty numbers increase radically in Australia over the previous decade. And that was reflective of what was happening around the world. And I wondered to myself why this procedure in particular was gaining so much popularity, because unlike, say, breast augmentation or rhinoplasty, very few people would actually see the results of the procedure. So it was this curiosity in me that started me on this now 10-year journey into genital surgery. And it's been an absolute blast. And I'm looking forward to the next decades to come. So just to give you a bit of a timeline of how I got to today, the 16th of June. So I started my PhD in 2013 at Adelaide in Australia, and I focused exclusively on labiaplasty during that time. But in 2016, I'd finished my PhD and I moved to Perth, which is in another state of Australia. And it was there I was able to expand this research to penile augmentation. So I'm going to be chatting about that as well today. And then I ultimately ended up in Melbourne, where I still am. In 2018, I started my first research fellowship, and that's where I was able to research both labiaplasty and penile augmentation, as well as looking briefly at a transgender perspective. And as Phaedra mentioned as well earlier, being part of those clinical guidelines in Australia in both 2018 and 2023. And I look forward to chatting more about that later in the presentation. So let's start with the earliest research from my PhD. And my very first PhD study actually didn't involve any patients. It was with a community sample. It was looking at what are the reasons why labiaplasty interest is increasing amongst women in general. And I should say most of the data I'm presenting is from Australian samples. So there may be some cultural differences between countries. So just giving you that heads up that this is an Australian perspective for the most part. So this is a very busy slide, and psychologists like doing fancy statistical models. But basically what I want you to take away from this is that we looked at a range of factors that hopefully you can see my cursor. Can you see my cursor, Phaedra, when I'm moving it?
Yep, you're fine.
Great, thank you. So basically a range of factors that can lead to people experiencing genital dissatisfaction and then consideration of labiaplasty, whether they actually do undergo it or not. So let's focus here on the left-hand side of the slide. So the way women's genitals are portrayed in the media was a really strong factor. And I'm embarrassed to say that back in 2013, I didn't look at social media specifically because it wasn't such a big deal then. So, I mean, how times have changed in the last 10 years. But I did look at things like pornography exposure, general internet, advertisements, cosmetic surgery, focused television, which were all influential on how women considered their genitals. But there were also factors like the conversations they were having with their friends about genital appearance, whether they'd received any negative comments from sexual partners in their life was very influential. And sexual confidence down here was actually a protective factor. So women who are more sexually confident were less likely to consider labiaplasty. And of course, the elephant in the room, pubic hair removal, which is a very common practice in Australia and around the world, considered standard grooming really nowadays. That was considered more of a setting condition. So it wasn't a strong predictor of interest in labiaplasty. It was more, in order to actually see what your genitalia look like, you have to remove your hair. So really a lot of sociocultural factors going on here in terms of media, conversations with friends, and negative comments from partners all being really influential. So again, that was a community sample, not patients. But I'd like to now move to my next bunch of studies from my PhD, where we actually looked at women's reasons for seeking labiaplasty preoperatively. So we can see here, and this is, I should say, the vast majority of my papers are open access, but if there is a paper that you can't access that I'm showing, please feel free to reach out to me. This was my very first paper in ASJ, so huge achievement. I was very, very excited. And what we did was we got the sample, I think it was about 35 women who were just about to undergo labiaplasty in clinics all around Australia. And we got them to write down in a survey what their reasons were for seeking surgery. And just going to move the Zoom thing here. We were able to categorize these into 4 main areas: appearance, functional, sexual, and psychological concerns. And we can see here in terms of the frequencies on the right-hand side, appearance concerns was the most common reason, but functional concerns were also right up there too, followed by sexual and psychological. So in terms of the appearance concerns, it really did match up with what we were seeing in that community sample I talked about earlier. So people saying it's not what it looks like on TV or pornography or social media. They felt they didn't look normal. The functional reasons were definitely there too. So sporting activities like horseback riding and cycling were uncomfortable, discomfort wearing certain types of clothing. The sexual reasons were both physical and emotional in nature. So some people having painful sex, but others saying it was more to do with being embarrassed in front of partners. And finally, broader psychological reasons, so to improve self-esteem and confidence. So those were the reasons for our women seeking labiaplasty. And we also compared these women to another group of women who weren't seeking labiaplasty. They were just going about their business at gynecology clinics. And we looked at some of those sociocultural factors that I showed in that earlier model. And bearing in mind that a p-value below 0.05 is considered significant. So it's no surprise, sorry, just making sure my cursor's on the right spot. It's no surprise that women seeking labiaplasty were much more dissatisfied with their genital appearance than the control group of women. In terms of other significant differences, there weren't that many. We can see here, in terms of internet exposure to genital images, women seeking labiaplasty had seen more, and that was also the case for surgery advertisements. I mean, that's not a huge surprise. They're seeking labiaplasty. Of course, they're going to be looking this up on the internet. There was also a difference in level of internalization, and that's basically psychology speak for how much women endorse the genital ideal. So that tends to be a sort of smooth, hairless, no protruding labia minora look. So again, not a huge surprise that women were seeking, or I suppose had that stronger internalization. And the final difference was that women seeking labiaplasty had lower satisfaction with life. But in terms of all their relationship factors and other psychological factors, there were no differences. So you'll often see people making comments like, oh, you know, people seeking labiaplasty are very psychologically unwell. Well, my data did not show that. It was really some differences in level of media exposure, satisfaction with life, and that they were very concerned about their genital appearance. And this, I should say, those reasons that I've spoken about of appearance concerns, functional reasons, they have been since replicated throughout the world, multiple studies. It's a very strong finding no matter where you go in the world. So it's great that these early results have been seen elsewhere. And because this research has been now so well done, the latest research from my team published just this year in 2023 in ASJ, we were looking at some other themes beyond motivations, like what were women thinking about their surgery more generally before having labiaplasty. And I'll share just some of these findings, again, published in ASJ this year. So in terms of what women were concerned about before undergoing labiaplasty, besides their genital appearance, they were concerned about how quickly they'd be able to get back to normal life activities. And also quite a few were very concerned about potentially losing sexual sensation. Even though that is quite a rare complication, it was very concerning for them. In terms of support from family and friends, we found that younger women in particular were far less likely to tell anyone in their lives that they were actually having a labiaplasty, generally out of embarrassment, shame and stigma, which is a real shame because we know that people who have good support after having surgery tend to do really well in recovery. So I hope that one day we can change this and they feel more comfortable to tell their loved ones that they're having this procedure. And finally, having support from the treating team, so that's the surgeon and the wider clinic, having in-depth conversations about why they're having the procedure and explaining what the procedure will involve was very comforting to patients, and also being given information during the consultation that they could take home afterwards was really reassuring for them. So I suppose what the research we're moving into a bit more now is the process of surgery and how to make women feel most comfortable when they're undergoing labiaplasty. So I'm sure you're far more interested in what actually happens in terms of labiaplasty outcomes. So let's have a look at that together. So this is research from 2016 published in Plastic and Reconstructive Surgery. So again, that group of women who were seeking labiaplasty and that comparison group, we looked at their results pre-surgery and post-surgery, bunch of standardized psychology measures. And what we found, again, looking at our p-values on this right-hand side, there was a big improvement in women's genital appearance satisfaction after undergoing labiaplasty, which is great news because that's exactly what they were doing the procedure for. So that would have been great for them in terms of their reaching their expectations. But in terms of other factors like relationship satisfaction, sexual confidence, psychological distress, self-esteem, and life satisfaction, there were no differences pre to post. So if women were expecting big changes in other areas, that did not occur, at least in my study. But these questionnaires can only tell some of the story. So we always get women to actually write down what they think changed for them as well. And this is very interesting to read what they wrote. So in terms of what they thought, as opposed to their questionnaire scores, they did feel that their relationships and their comfort during sexual intercourse had improved. And they also felt generally more confident. They felt more comfortable in their clothing, and they certainly felt better about their genital appearance, as we saw from the questionnaires. I suppose something that was quite interesting is the last theme here. That some women wanted more tissue taken off than their surgeon was willing to do. And we do hear this actually quite commonly, that they really want that very resected look. And we often hear that surgeons will push back on that for safety reasons, even though the woman might be seeking that kind of look. And I add one more finding from one of our qualitative studies published in ASJ in 2016, just deep diving a bit more into those sexual satisfaction outcomes. So we can see here in the first quote, this woman said, "I feel a lot more comfortable having sex now because I think I used to be a bit ashamed or like tend to protect myself, even though I'm very comfortable with him," her partner. We've been together for a long time now, but I guess I feel more free now. So that's speaking to that improved sexual confidence, sexual satisfaction. But this second quote, I think, explains why we don't always get that improvement in sexual satisfaction and confidence in every person. So she says, "I still do find it hard to relax during oral sex. I've got years of issues in my brain about it. That's something that doesn't just go away with a new vagina." So while she was happier, and she's reflective of quite a big group of patients, she's saying this new genital appearance is very satisfying. I am very happy with it, but I still have some remaining psychosexual issues that surgery was never going to fix. So it does speak to, I suppose, the combination of surgery with psychological input with people who have psychosexual issues. So that was the outcome section, but the holy grail, I think, for psychologists, and I like to think also surgeons as well, is being able to identify who's going to be most satisfied with a particular procedure and who is not, in order to determine patient suitability. And I share my really preliminary research from 2016, published in Plastic and Reconstructive Surgery. So we put in a bunch of demographic characteristics, as well as some other psychological measures that we collected at baseline, and saw how that related to satisfaction at 6 months post labiaplasty. And we found not very many significant predictors. So I suppose it wasn't as elucidating as we'd hoped, but it was a small sample. And as I said, preliminary research. But what we did find was that women who were in relationships at baseline were less likely to be satisfied. And also women who are experiencing more psychological distress pre-procedure were more likely to be dissatisfied. So the reasoning we proposed for that back in 2016 was that we thought these women may have some unrealistic expectations for how their relationship might improve, and also how their psychological well-being might improve after having labiaplasty, and potentially when that didn't occur, they were a bit less satisfied. But overall, the women were generally very satisfied. So it was a rare exception that anyone wasn't. So the last part of our labiaplasty section is looking at, so I've shown you a bunch of individual studies that I have led, but we've now got to the stage in labiaplasty research where we can actually combine study results into systematic reviews and meta-analyses. And I'm going to show you the results from 2 that I've been involved with. The first being published in ASJ in 2020, where we were looking at the combined effect of labiaplasty on women's self-esteem. So it's often, well, as you've seen earlier in my talk, women will say, I want to improve my self-esteem. So does that actually happen? And at this stage in 2020, there were only 5 studies that met our eligibility criteria to be included in that meta-analysis, or that, I suppose, is overall quantification. And we found that, yes, indeed, labiaplasty did improve women's self-esteem in the 5 studies that were included, and they represented lots of different areas around the world. So a really good outcome there, that if you combine all the studies, it does look like labiaplasty improves self-esteem. And the second one I'm a co-author on, and this was published in ASJ just this year, 2023. And it was looking at that genital appearance satisfaction outcome, which is very much the major outcome of this procedure. And again, only 5 studies eligible for this meta-analysis. So we are still pretty scant on data. But just like self-esteem, it appeared that labiaplasty improved women's genital appearance satisfaction. So just like I showed in my earlier research. So by way of quick summary, because we have been through quite a bit of content now, it looks like women's reasons for seeking labiaplasty are multifactorial. There's appearance reasons, functional reasons, psychological and sexual reasons, and generally women tend to report all 4. The appearance-related reasons tend to dominate, and they are driven by sociocultural factors like their conversations with their friends and partners, as well as the way genitals are portrayed in the media. There are generally positive outcomes for labiaplasty, maybe not on all domains measured, but certainly reducing that appearance-related distress is a very strong outcome across studies across the world since 2016 and before that. I think a major oversight in my PhD was that I did not examine the effects of labiaplasty on body dysmorphic disorder, which is generally known as a contraindication for cosmetic procedures. And I'm sure you're all aware of it, but just in case, BDD is a psychiatric disorder where a person believes they have a flaw in their appearance that isn't observable to others, and they really obsess over this flaw. And we tend to find that they don't respond well to surgery. That's why it's considered a contraindication. So it was a bit of an oversight for me to not include that in this research. But research led by David Veal and others in the UK has shown that labiaplasty might actually improve body dysmorphic disorder symptoms. So a bit of a surprise there compared to other procedures and compared to the literature. But certainly we need more research to know if BDD is a contraindication to undergoing labiaplasty. So let's switch gears now. So I've finished my PhD and I'm now about to embark on this penile augmentation research. And I'm sure the people listening to this recording and joining me in the Zoom room now would know that there are many different types of penile augmentation procedures. There's lengthening, there's girth modification. So the research I'm presenting focuses solely on an injectable penile augmentation procedure, specifically hyaluronic acid, and it was injected into the penis to increase girth size. We have published this in ASJ in 2017 if you'd like to know more details about the specific procedure. And I shout out to my co-author there, Jason Oates, who actually got me into this field in the first place. And it's been a really, really interesting volume of research that I've been able to do. So let's have a look at what the men say are their reasons for having penile augmentation. And unlike my PhD, I didn't do any community studies. I jumped straight into the patient studies. So what you're seeing on the screen there is what men reported their reasons were for seeking penile augmentation. This was actually with a group of men who'd already had the procedure, so a retrospective study. So not quite as rigorous as a prospective study, but still valuable information. And we published this in 2019 in ASJ. So just like for the women, there's a range of reasons. So men are saying, I want to improve my self-perception. I want to feel more confident. I want greater self-esteem. They're also talking about addressing psychological distress. So this tends to be teasing from sexual partners about their penis size. That's what's motivating them. They're also talking about improving their own sexual pleasure, as well as that of their partners. Of course, appearance reasons too, wanting it to look bigger, makes complete sense. And then combination reason. So I suppose unlike with women, the distribution of reasons is a bit more spread. It's not all appearance. In fact, self-perception seems to be the most common factor, but only slightly. But let's have a look at this in a prospective sample. So we published this in ASJ in 2022. So a group of men, I think it was about 20 to 30 of them, seeking injectable penile girth augmentation, getting them to write down their reasons, just like we did for the women's studies. And again, improving confidence comes out on top. So clearly men are thinking that this is going to improve their confidence, having this penile girth augmentation. Then, understandably, changing penile size, sexual function and pleasure, as I mentioned before, addressing feelings of insecurity. So that's that psychological distress, generally related to comments from friends and partners. One man said he wanted to address medical issues, and then our combination reason. So you can see here, improving confidence is the most common answer, but there is a spread of answers across these categories. And I will say that the penile augmentation research is, I suppose, a little more varied than the labiaplasty research. So just the way these reasons are gathered really tends to differ a lot between studies. I sometimes read papers where it just says the man wanted a bigger penis. I mean, of course, that's why he is there. But in terms of a deeper dive on their rationale, that isn't always conducted. So I think our research is quite novel in that way, that we've dug a bit deeper into their reasons. I also had the pleasure of interviewing some men who were seeking penile girth augmentation as well, and that was published in ASJ in 2019. And I was looking at some of those same sociocultural factors that we were finding in women. Did they stand up in men too? And it looked like generally they did. So pornography was definitely an influence on how men felt about their penis size. So we've got this delightful quote here of, everybody would love to look like a porn star, wouldn't they? And that was certainly a very common theme. But there was also how they compared in terms of their penile size with their peers. So this quote here, those who think they've got it, they flaunt it. So you're always kind of comparing yourself to someone bigger, really, aren't you? So that's that locker room syndrome, really, and that the man with the biggest penis is generally the guy with his towel off parading around the locker room. So it's I suppose unfair comparisons with men who are bigger rather than comparing across the population. And finally, that appearance-related teasing was definitely coming up in this study as well. But it was suggesting that it's not always direct, that in fact, having a small penis is a source of mockery as a kind of societal narrative. And we can see here in this quote, the guy says, I mean, how often have you seen on a TV show where a woman might be angry with a guy and make a comment about his penis, and it's a way of sort of emasculating him? So using penis size as, I suppose, a weapon of insult. And certainly there's a fair bit of research to back that up outside of penile augmentation research. But basically the influences of media through pornography and also how people relate to their peers held true for men as well as women. So what actually happened to these patients when they had undergone that injectable girth augmentation procedure? Well, we can see here, so this was published in 2019 in ASJ, again, looking at our p-values of what's significant and what's not. So pre and post-procedure, genital self-image improved. So that's as we might expect, and it was exactly the same for the women. We also found improvements in body dysmorphic disorder symptoms, so a bit of a surprise there maybe. In terms of self-esteem and relationship factors, because we know that they're important, it looked like men's self-esteem improved, but in terms of other relationship factors, there were no differences. And this is from our most recent research published in 2023 in ASJ. The variables we looked at, or the measures we looked at pre and post-surgery, again, this was a 6-month time frame. The K10 is a measure of psychological distress. The RSES is a measure of self-esteem. And the Bickley is a measure of body image-related quality of life. And out of these 3 measures, only self-esteem improved. So this is matching up across our studies, really showing that it looks like men's opinion of their penis improves, and also their overall self-esteem improves after having girth augmentation. And fortunately, I did learn from the mistakes of my PhD. I did include body dysmorphic disorder in this research. So we found that prior to undergoing penile augmentation, about 7 to 11% of men met diagnostic criteria. But 6 months after the procedure, they all lost their diagnosis. So they no longer met criteria for body dysmorphic disorder. So a very interesting finding there. And just in terms of what the men said themselves, in addition to our standardized questionnaires that we gave them. So they're talking about increased self-confidence, makes sense. It was coming up in their questionnaires as well. They talked about increased sexual pleasure for themselves and their partners, a positive impact on their life overall. But there were some concerns as well after having the procedure, just like there was for labiaplasty too. So some men reported that the filler was not evenly distributed across their penis, so some aesthetic concerns. Difficulties during sex as well for a minority, and then just no change for others. So it's not all sunshine and lollipops. There are certainly people who aren't satisfied, but the vast majority are very satisfied with this procedure. So again, a quick summary of the penile augmentation research. So just like for women, men's reasons for seeking penile augmentation are multifactorial. There's self-perception, there's appearance reasons, functional reasons, sexual pleasure. You've got it. It's all mentioned there. But in terms of the most common reason, wanting to improve their confidence, their overall self-perception is crucial. Generally very positive outcomes for this injectable girth augmentation procedure, at least. And this is particularly for the way they think about their genitals and also their overall self-esteem. As I mentioned earlier, the men in our study, they seem to lose their body dysmorphic disorder diagnosis. And again, this seems to go against all of the BDT research that has been conducted. And it speaks to that we need to do more research in this area, but potentially if men are more sort of mild to moderate on that dysmorphia scale, potentially cosmetic procedures are not a contraindication. So we definitely need to do more in this space, but it seems like it's not that hard and fast red flag contraindication that we thought it was, at least in the genital space. And I often get asked about this, and I wonder if, particularly with, say, labiaplasty and penile augmentation, the outcomes are generally quite well defined. So a smaller labia minora and a thicker penis, as opposed to, say, rhinoplasty, where there'll be multiple aspects of the nose that that the person could focus on after the procedure, as opposed to just size differences. So I think there's more subjectivity in the outcomes of rhinoplasty versus these genital procedures. But of course, if any of you have any thoughts, I would love to hear it. And yes, I'd love to do more research on body dysmorphic disorder. So I mentioned that I'd done a tiny bit of work from a transgender perspective, and this is an area I would love to do more in if I have the opportunity. And I've published one paper in ASJ in 2021, and basically saying, hey, these genital procedures are not just in cisgender people, as I've been speaking about earlier. Transgender people are, of course, seeking genital procedures, and we tend to think of it more as, I suppose, a gender dysphoria issue for transgender people. They're saying, hey, this, pardon me, just having a quick drink. Sorry about that. So transgender folks are saying, hey, my genitalia does not match my gender identity, and then seeking gender affirming surgery. But what I think is missing in this dialogue is that they also have the same body image concerns that cisgender people do too. So it's gender dysmorphia plus body image concerns. So I think you may have a successful, quote unquote, gender affirming surgery, but the person may still be aesthetically unhappy with the outcome. So I think there's, obviously this is a very complicated issue, and I'm not doing it justice by speaking about it so briefly, but I would love to be doing more research on genital self-image in a transgender space, and it's very much needed research. And Phaedra mentioned in my introduction that I've been lucky enough to be part of some clinical guidelines in Australia, which have been translated around the world, for how mental health professionals can assess patients who are seeking cosmetic surgery to see if they are have any red flags, if there's any contraindications that we should be aware of. And the reason that this has become such a big issue in Australia in particular, and I would love to hear what the landscape is like in everyone else's countries, is that prior to July 2023 in Australia, the mental health screening of patients seeking cosmetic surgery was optional. It was recommended, but it was not mandated. But after July 2023, it's going to be mandatory. And this has caused a lot of, I suppose, debate in Australia about how this might actually work. And I include on the slide some newspaper clippings that have been released this year about surgeons being worried about how on earth this is actually going to work, that they need a referral for a cosmetic procedure through their general practitioner, their usual treating doctor, who will then refer on to a psychiatrist or a psychologist. So I think, I mean, obviously I'm biased as a psychologist. I think it's great that there is more mental health screening of patients to make sure that they're getting the treatment that will best help their concerns. But in terms of the actual implementation, that really hasn't been given a lot of thought. Our GPs are already very overworked. And also we don't have enough psychologists and psychiatrists to conduct these assessments. So it's going to be a very interesting time from July onwards in Australia. And I would be happy to report back at a later date as to how it's actually gone. But I myself am obviously putting up my hand to do these assessments for people, but I'm only one person in Australia. So we're trying to form a larger group of psychologists and psychiatrists who can do this work and make sure that these assessments are done properly. And in order to do the assessments properly, we have just released our latest upgrade to our clinical guidelines, guiding psychologists as to what to look for when they're assessing patients who are seeking cosmetic surgery, including genital procedures, as I've been talking about earlier. And I have here on the right-hand side of the slide some of the things we look out for when we're doing these assessments. So having unrealistic expectations for the procedure, being unduly influenced by others, that tends to be in the genital space, partners. I certainly have seen that come through. Having identity concerns and negative self-image, relationship issues, and certain mental health issues like body dysmorphic disorder. But as I described earlier, it may not be the contraindication that we think it is. So these are, I suppose, general guidelines for psychologists to be using to undertake these assessments. But certainly, and more work to be done in this space as to identifying those risk factors more clearly, and knowing what definitely are red flags and what are not. So that's why I have the question marks there, because this is a rapidly evolving landscape here in Australia, now with mandated assessments versus optional, and how on earth we're actually going to get it all done. I think it's going to be a really tricky time the next couple of months, but hopefully we can form a clear pathway for patients such that they can still get their surgeries done, and we as psychologists and psychiatrists and mental health professionals are ensuring their psychological safety to undergo these procedures. So in terms of future research that my team is doing, so we have more female genital cosmetic surgery papers in the works. So hopefully you'll see them in the not too distant future. And as I mentioned, I'm quite heavily involved in the mental health assessment implementation strategy in Australia. And I must say that as a psychologist, my job is to prevent body image concerns from happening in the first place. So not to take work off surgeons, of course, but ideally people wouldn't have these concerns in the first place and require surgery. So I've been doing quite a bit of work in how to promote having a positive attitude towards your genitals in younger people, particularly those in schools. So that's quite a bit of what we've been doing recently. So I just want to say thank you all so much for listening in, and some very quick acknowledgements. Of course, all of the participants we've had in our studies over the past 10 years, it's just enormous numbers now. My wonderful co-authors, I've had many co-authors, but special shout outs to Naleshni Fernando and Doctors Jason Oates, Christine Hamori and David Sauer for being part of my research for a very long time. All of the funding bodies who funded this research, multiple bodies around the world, not just in Australia, and the wonderful ASJ team. And I include there a picture of myself and Phaedra. I was lucky enough to go to a Yankees game with her last year, which was absolutely amazing. And
that was so much fun.
It really was. And I hope to come back to the States soon, and also encourage all of you folks to come to Australia, come say hi to us in Melbourne. It's a really, really cool place. And just to finish up, my contact details are there on the slide. So if there was a paper or something that you wanted to ask me about, please just contact me via Twitter or email. Thank you.
Gemma, thank you so much. That was brilliant. What a huge, an amazing overview. And as you were going through the different subsections, I was putting in the chat box the articles that you've published with us.
Oh, thank you.
Yes,
that's very good of you, Phaedra.
We're grateful for all of the research. I think because we have a more intimate group today, I'd like to start by asking our other participants here if they're free to do so, to turn on their cameras. and maybe we could have a little bit of a group discussion. I'd like to start, if possible, talking about the legislative changes and requiring mental health evaluations. I think that's really, as you mentioned, kind of a sticky wicket. So if anyone here attending is free to do that, or if you want to stay off camera and just kind of voice opinions, I don't want to call on anyone specifically, but I will, because I'd really love to hear what's happening in their countries, if they're seeing something similar, what their take is, and kind of talk about this particular topic.
Hey, Phaedra, it's Chris Constance from Florida.
Hi.
I just want to say, Gemma, great discussion, a lot to unpack. And
thank you so much.
I missed a little bit of the beginning. Is the legislation for all aesthetic surgeries or just for gender affirming or gender or augmentations or reductions, things like that, for gender
all
procedures?
aesthetic surgeries. It's quite a broad brush. So no non-invasives, only the invasive surgeries, but yes, all aesthetic surgeries.
I guess my question is, what was the genesis of that? Was somebody being a really bad actor, and then it affected a legislator's family? And because that's usually what happens, it's kind of blowing me away.
Yeah, there were quite a few kind of exposés on TV shows about people not being very ethical in this area of medicine. And I think that's what prompted it, as you suggested.
Interesting. Well, I would really say that, your approach has been incredibly comprehensive. And yes, there are a lot more questions that come from your answers, but, certainly it's something that, I applaud you and hope you'll continue on your research, because I do think it's something that it's hard to get honest answers out of people. That's the other side of it. A lot of what we do, I think you can get people to be honest, but for this particular area, I think they're going to be a little bit more closed-mouthed about, what really is going on. And I think you're probably right that it's a lot of it's driven by opinions of other people versus self, which is kind of sad.
Yeah, thank you so much, Christopher. It's as you said, it's such a particularly in Australia, quite a shameful area to talk about, and I think that does inhibit honesty. At least, I suppose, what we have going for us is that we are independent of the clinic usually, so the surgeon doesn't see these results, only aggregated results, but absolutely they could still be withholding even in this independent research.
So thank you so much, Doctor. And I know we've got Dr. Dane online with us too. Are you in the States as well, or are you overseas?
I'm overseas. Hello, I'm based in Guatemala. It's Central America. And here we don't have any legal enforced to send patients, or that the patients required to see a psychologist or psychiatrist before any procedure. If we as plastic surgeons, we want to send them, we can, but it's for for our reassurance that we're not doing a risky procedure on someone that might not have any benefit of it.
So what is your feeling, Dr. Udane? Do you think that this is just a little too much, what's happening in Australia? Or, what's your sentiment?
Well, my sentiment is that you had something similar in the US, right? In Florida. That's why I believe Dr. Christopher Constance was suggesting that maybe some bad actors were the source of this, because you had the issue with the BBL that they enforced that no more than 3 procedures, and then the use of the ultrasound and etc. I believe that nobody wants to do any harm. So I think that the public institutions, they want to do good towards the patients. And it's a very complicated issue. So I couldn't say if it...
Well, if I could chime in for a second, I agree. We put in our state safeguards in for patient protection, but it doesn't involve psychological profiling. And I think that's an incredible overreach because you're basically saying people aren't smart enough to decide for themselves, and you're going to let the state step in and have another layer. I mean, I think it's too much, you know. And I think if you have certain practitioners that are doing the wrong thing, that's why we have boards of medicine in each state. You know, we have ways to police ourselves, and I think maybe the testament to this country is we haven't had to go that far because we've been policing each other so well.
Exactly.
Yeah.
I totally agree. But we have a saying here in I don't know, in Latin America that non-sinners, they pay for sinners. So that's one of the things that's the issue. Putting a law for everybody when the problem might not need this kind of enforcement or mandatory thing. So it's a very difficult, I mean, it's like everything that's political, it's kind of hard.
And I think in Florida, the issue was so acute and so specific to deaths related to BBL and where they were placing the cannula, how many they were doing, what type of credentialed or non-credentialed hospital these procedures were happening in. It was sort of just the trifecta. In fact, when I was in Miami at the annual meeting, we were with Max Polo, who I'm sure you know, Dr. Constance. He's president
Yes, I know
of the
Max.
Yeah,
Very
the
well,
board of plastic, the Florida board, right before the vote was happening. So he, Pat Pasmino, Jeff Kenkel, we filmed a video roundtable, which we'll be publishing. It's actually in initial form on ASJ. Soon it'll be in final form. It's a great video about BBL, gives you some of the historical background. But I think that was so, like, people were dying because of what was happening in Florida. So I think there was,
but remember this, the new rules have occurred. I was president of the Florida Society back in 2017 when it was happening. It took 6 years for us to get the legislature to wake up, and it wasn't one big movement. It was little nibbles at the issue, and it wasn't enough. It wasn't enough. And then finally, we had to institute these types of rules because the non-plastic surgeons were doing it in strip malls,
yes,
in non-hospital, non-surgery center. So there just wasn't enough regulation within the state to keep the bad actors going, because the business people would hire the doctors, bad outcomes would happen, they'd shut everything down and reopen down the street.
exactly.
I have a question. Sorry, I have a question to Professor Sharp after what Dr. Constance and Fedra have told. Of what I see in the US is that let's say the good guys, or what you said, you make teams and you try to make things better, but from the side, not from the public side, from the ones interested here, the plastic surgeons. What's the position of plastic surgeons in Australia, the society, or is there any teams? Because it's a very hard rule that they are going to implement.
Yes.
Yeah, so there has been a lot of controversy with some societies being quite opposed, suggesting, as you good folks have been saying, potentially this is overreach, over governance. I suppose, again, I'm biased, but I think I wonder if psychologists should be part of routine care anyway for cosmetic procedures, because there's just so much body image concern, psychological distress driving these issues. And I suppose what I always say is we just want the best outcomes for patients too. We're not there to be gatekeepers. We're there to actually enhance your practice. So, and the vast majority of patients I see, I give the green light to. So it's not actually declining surgery at all. In fact, certainly the patients I've worked with have thought it gives them an extra care, extra assurance that the surgeon is giving them the best offering. So
Gemma, if I could say, you're adding a bit of a time factor, you're going to add a cost factor. I don't disagree that in a perfect world, really it's why not? I mean, if you can assure a proper procedure and a proper candidate. Having said that, though, okay, in my practice, I'm doing facelifts on people in their 60s, 70s, and 80s. And if they're in their 80s, which I never thought I would do, it's because they have a busier schedule and they're more physically fit than I am, And who am I to tell them, that they can't get it done? Their calendar books are just full of things to do. So I would say that probably gets a pass. I don't think those individuals need psychiatric evaluation. They are older. They have absolute deformities of aging that need to be corrected. Now, if you're dealing with somebody who, and honestly, I don't do BBL because I think it makes patients look like cartoon characters. When you have younger individuals that are dealing with social media, and that was the last poll question, I do not let any of that stuff influence me. I deal in reality. And if somebody comes to me and says their nose is bad, then I show them how they're doing, they got a wide angle camera on their nose when they're doing a selfie. It has nothing to do with their actual appearance. Get some software that makes you look normal with a close-up camera, or get a better camera to get your image. But at the end of the day, we've got to be very careful about those individuals between, say, 21 and 35 that are constantly on social media and dealing with that pressure. And then, maybe see, what I do is I use a psychiatrist as a backstop. If I have an aggressive patient that absolutely wants something done and they won't listen to me, I say, okay, but you first need to see Dr. Smith, because that's my protocol. And if you won't do it, or the other safe thing to say is, I'd like to help you, but I don't possess the skill set that will get you to the result that you're trying to achieve. It doesn't say I'm a bad surgeon. It just says I'm not going to be able to apply my skill set to your issue because you don't have one. But it's a polite way of saying it. And at the end of the day, I definitely think there's a plug-in for psychiatrists and psychologists with our patient population. And a plastic surgeon would be mad in the head to try to get things done without leaning on that area. But I don't, in this country, as pervasive as we are and what we do, and a lot of us are doing it right, and there's a small minority that aren't doing it right. Some, very few, are board certified plastic surgeons. The majority have no business touching patients in an aesthetic or cosmetic way. Yet we fight that every day. And in fact, we're fighting PAs and nurses doing it. I mean, it's kind of a disaster.
We have the same problem. Yeah. I
really
suppose
appreciate
that's not at all. Thank you. And that's part of the reform in Australia as well.
I believe
that, oh, sorry. Feel free to go ahead.
I'm sorry, was someone trying to chat?
I think it was Dr. Dane.
Did he freeze? Dr. Dane, go ahead.
Yes. I was thinking Dr. Constance had some very lost signal.
Oh,
okay. Well, while we're waiting for that to correct, Gemma, so what is Australia's government saying if a doctor is caught not following this rule? What is
I don't know yet, Phaedra. I'm not sure how they're going to police this because it is just so widespread. It is a bit cart before the horse. Certainly, we're getting a lot of surgeons who are interested in following the rules, and we've never been more popular as mental health professionals. But yes, I do not know how compliance is going to be checked.
I guess we'll stay tuned there. So doctors, we have a few minutes left. I would like to toggle off of this topic and again, give the floor to Dr. Constance, Dr. Udain. Dr. Sharp covered a ton of topics from labiaplasty to penile augmentation, BDD we kind of just touched on. Do you have any other questions for her that we can, that you can ask?
An hour doesn't do you justice. I appreciate the fact that you kept mentioning you could do a whole study on just, each aspect or an hour on certain aspects of what you talked about. So, but I appreciate your time. And Phaedra, thank you for sending multiple emails, because I always miss these, and I just happened to see it yesterday, and I said, I'm going to get on
so
this.
Glad.
And
thank you so much for picking mine to attend. I appreciate it.
Absolutely. Well,
may I ask?
Please.
May I ask a last question before saying goodbye? Does this enforcement you're seeing in Australia, does this mean that the psychologists or psychiatrists are going to be sure they're sending the patient to a plastic surgeon? That could be a good thing if they are staying sure that the patient is going to a plastic surgeon after the evaluation. No, let's say no other non-core specialty, or even not a specialist at all.
There's I think I caught all of that, Dr. Uday, and I do apologize if I missed any bits of it. But what's happening in Australia is that they want to protect the term surgeon more. At the moment, it can be used by anyone, and that's not okay. People without training can call themselves surgeons. And also a proper training program for aesthetic surgery, because at the moment that does not exist. So they have now built that standard, that training program. So I think there is definitely work being done to ensure that people who are doing aesthetic surgeries are qualified to do so, unlike currently where it seems to be a bit of a free-for-all.
With that, I'd like to thank you for your time. I know, Dr. Sharp, it's now 3 a.m. in Australia.
I know, I'm going to go out party now.
For sharing an amazing
Feeling very awake.
It was an invigorating chat. Dr. Constance, Dr. Udane, thank you for being with us.
Thank you so much, everyone. Really great questions. And I hope I can come back and tell you what happened in Australia.
We'll stay tuned.
Thank you so much. Really appreciate your time.
Thanks, everyone.
Thank you very much.
Bye.